Hello everyone, welcome to Health for You by UBE Media. My name is Dr. Pranav Kumar. I am an orthopedic surgeon and I mostly do spine surgeries. I've been trained in England for spine surgeries and probably I am the only person in Indore who has been trained by neurosurgeons. Otherwise, normally orthopedicians are trained by the orthopedicians and the neurosurgeons by the neurosurgeons. There are lots of topics where there is lots of confusion as far as spine is concerned. One of those topics is sciatica. The general misconception is the sciatica is a problem of only the nerve. Let me make it very clear, it's not the nerve which is getting the problem. The problem is in the spine most of the times or the hips. By definition, if you talk about sciatica, it's any pain which arises from the back or the hips and travels down the leg is called a sciatica. The general problem with the sciatica, the reason sciatica is very untreatable or people don't treat it properly because they don't understand the basic cause of it. If you understand the basic cause being the back or the hip, then you can treat it. But here you see daily, and I daily see patients who are coming with symptoms of back pain, with the pain shooting down the leg, and they have been given multiple injections of multivitamins and all those things, and they don't improve because you are not actually treating the cause of it, you are treating the effect of it. So if you treat the effect, it's like treating the fever for say. If you don't treat malaria or typhoid or whatever is causing the fever, you will lose the patient. Similarly with sciatica, if you don't treat the back, you will not be treating the sciatica. So that's the reason it is a dreaded problem. If you talk about sciatica, it's mainly of two types: acute and chronic. Acute is one which is coming within a few days and it will last for a few weeks. Chronic sciatica is the main culprit because it's there for more than at least 3 months. The symptoms are like you have a back pain and then you have pain shooting down your leg, and depending on the nerve, the pain shoots down either on the inside or the outside or the back bit. If you talk about the causes, the most common cause is of course nerve compression due to the disc. Second is stenosis, which is compression of the nerves because of either the bone or the ligament which is coming and occupying the space which is there for the nerve. You can have osteoarthritis of the joints which can cause compression on the nerves and then you have shooting pain down the legs. And you can also have slip of the bone which will cause the compression of the nerves, and these are the reasons you have. So if you see, it's not the nerve per se which is the problem, it's the problem with the spine which is causing the problems. So if you treat the spine, then you will be able to treat the sciatica. Diagnosis most of the time is examination based, and you need to consult a doctor if you are suffering for a long time and you are in agony. Then you need to consult a spine surgeon who will be examining you, and then most of the times they do improve with conservative management as in self care. You need to change the way you are doing the things. It's most of the times these small things which helps you a lot. It's not the surgery, it's not the medicines, it's the exercises which are the main thing. If you stabilize your spine biomechanics is better. Most of the times that's what helps you a lot. And there are studies published, there are sports trial going on in US, there are others trials going in Europe, which conclusively prove that most of the times you don't need an operation, which is the general belief. But if you need an operation, it's no point delaying the operation because the prognosis or the results will be worsening if you delay it for too long. If you talk about surgeries, there are two kinds of surgeries. It's either stabilization or a decompression. Most of the times it's just a decompression, which is removing of the pressure on the nerves, either the disc or the ligament which is causing the problems. Or sometimes you end up having an operation which involves putting screws and stabilizing the spine because it is moving frontwards or backwards. That's the main thing. So you need to understand that the most important thing about sciatica, it's not a disease, it's a symptom. You need to treat the disease to get rid of the symptom.